Hello, and good morning, good afternoon, good evening, and good day, and welcome to all who are participating on today's educational webinar. I'm so excited to be here to give you and present this webinar to you on the topic of minimal invasive dentistry, solving anterior aesthetic challenges with composite resin. My name is Dr. Win Okuda, and I am the past president and an accredited member with the American Academy of Cosmetic Dentistry. And you can, if you ever want to try to reach me, you can reach me one of two ways: through my website, through okudacosmeticdentistry.com, or directly from my email, wokuda@gmail.com. As I mentioned, I'm very excited because this is a true worldwide webinar. And being a true worldwide webinar, I noticed there are people from all over the world that are on this. And so I welcome you all, and I hope that we can all learn together how we can create predictable and consistent results for your patients. I'd like to, first of all, thank GC America for supporting this educational program. GC America is one of those wonderful companies that features so many innovative restorative products, preventive products, and all kinds of things that, around the world that really help to create a better world for us in the dental profession. But most importantly, they continually support continuing education. So thank you, GC America. For your information, I'm conducting this webinar here in beautiful Honolulu, Hawaii, and I hope that one day you will all get a chance to come here and visit me. I'm not vacationing here. I live and practice in Honolulu, so I'm staring out at the beautiful ocean at this time. As for today's webinar, I invite you to ask questions on the topic of minimal invasive dentistry. I'll be able to see your questions and hope to answer your questions within this discussion. So please be patient. If the question doesn't fit within the format of the discussion as we're going along, I'll try to answer your question after my presentation as time is allowed during the Q&A session. This webinar has a time limit of 60 minutes, so I apologize if I can't answer all the questions. However, I'll try my best. I think one of the best things about practicing for the last 25 years here in Hawaii is that it is truly a melting pot of diverse ethnicity, from Caucasian to Asian to Hawaiian to all kinds of different ethnicities. These are people who live in Hawaii, and I treat all of them, and I've created all their beautiful smiles, as and some of these in composite resin. And so, because I treat a diverse type of demographic of patients, I've developed a style in which I do dentistry so it fits for all different ethnicities. And so that's why I'm so excited to be here teaching you some of the things that I've learned through the course of my years. Here is a partial curriculum vitae of mine, just things that I've done in my past and I do presently. And I don't want to bore you with all the details, but I just thought I'd put this up so that you can see some of the activities that I do as a professional and clinician and a leader and a key opinion leader here in America and around the world. As for the learning objectives for today, I wanted to clearly define these for you. We want to be able to create natural results with both a simple and complex layering sequence using the latest in state-of-the-art composite resin. We also want to learn how to be able to do correct preparation design in order to achieve invisible margins, and then finally to be able to properly layer composite resin for natural results. So these are things we want to try to achieve, but then certainly I hope that you'll learn a lot more. I do want to say that this webinar is being supported by GC America. However, and although you'll see a lot of GC America products within the context of this lecture, you'll see other products within the context of this lecture. And it's because this is the way I practice. I am a 100% wet glove clinician, and so because I have a practice and that has 10 staff members, I'm the only dentist, and so I need to be sure that I'm able to create the best quality restorations and best quality results possible for my patients. And so this is an important part, the word quality, because if I don't have the correct materials and the correct techniques that I use, there's no way I'll be able to create predictability and consistency. Because to me, this is the most simplest way of being able to achieve success, and the only way I know how to achieve success. Now, this is important for you all too, because it's not just about success, but also about your reputation in your communities and your patients. So it's important that we be able to teach and learn from one another in order to get the correct results and be able to keep our reputations intact. Well, today it's all about restorative predictability. We want to be able to achieve this word here every time we restore a restoration, whether it's a composite restoration or an indirect restoration. Restorative predictability is very important. But most importantly, how that interrelates with clinical predictability is important, because when you have a situation such as this, and you are needing to have the best results possible, we want to be able to have clinical predictability. So it's not just about the way the materials are, but how it interrelates with color and contour and texture, so that we're able to, and surface luster, and so we're able to have good long-term results. So as I mentioned, it's about good technique and great material science equals predictable, restorative, and clinical success. At this time, as we're looking at this result, you can see how I'm able to create a very invisible restoration on this tooth. And so one of the things I wanted to ask on a poll is to see how, first of all, we'll be having some polls along the way, and one of the polls has to do with invisible margins. So I want to poll the audience right now as to the question, do you have any trouble creating invisible margins with restorations? So I'm going to start the poll. It's a very simple yes or no answer, but I want to see where we're at around the world here. I'll give you about 10 seconds to answer. Voting is still going on. Creating invisible restorations and invisible margins is really, it can be very tricky if you have, number one, the wrong technique, and number two, the wrong materials. And so in order to create predictability, that is something that we need to be sure that we have both of. Okay, so it looks like everyone's pretty much done. So let's take a look. We'll close the polls, and let me show you the results. I think you'll be surprised that almost 70% have problems with creating invisible margins. I find that to be really important, because in the end, our patients expect us to have, in this day and age, to be able to create the best results, which are invisible margins or invisible restorations. And a lot of it has to do with, as I mentioned, good technique and good material. So let's talk about how we can change that so that by tomorrow you'll be able to feel more confident with that. Okay, good poll. And you can see here in the result of that class 4 how we can make it look very, very, just a very nice aesthetic result. I hope you would all agree with me. This to me is a very important thing that we now have in our lives. It's called smart technology. I'm sure you've all heard of this term, and you've probably heard of this term as it relates to more so these types of products. Things that we see and use every day in our lives, whether it's smart keys, smartphones, smart cameras, and smart computers. These are all smart technology, examples of smart technology that makes our lives easier. And so, this is an important thing, because in dentistry, to me, if we can develop things that are in the arena of smart technology, it will just make our lives not just easier, but be able to feel better about how we're able to perform dentistry and not have it be so stressful. Wouldn't that be a good thing? Well, my practice manager tells me I need to drink smart water, so I try to drink smart water. I don't know if I'm getting smarter, but I still drink it. Do we have smart technology in dentistry? That's an interesting question. I'm thinking about that. Well, here's a good example of smart materials in minimal invasive dentistry. This is there are many times where we get into situations where we'd like to be able to do a minimal invasive procedure, such as, and I'll show you here with my arrow, such as this, the distal of a tooth, to be able to get to this decay without having to cut out the whole marginal ridge, and to be able to restore it like this. Or let's say, for instance, if this tooth had an adjacent tooth and you did a tunnel prep from the surface to get to this lesion, to be able to do that and be able to simply fill that. You know, what do we have in dentistry that allows us to restore this? Well, certainly, you know, there's a lot of times we want to pull out that flowable resin, you know, and that flowable resin to be able to restore it. But as we know, conventional flowable resins are just not restoratively sound materials. They're very weak materials because they're heavily the ingredients of that have a lot of unfilled resin and resin matrix, so it doesn't allow it to be strong. But it would be nice in situations like this right here to be able to use a flowable type of composite to be able to create a result like this, wouldn't it? And so this is where GC had come up with this liquid injectable composite resin. It's in a category all its own. It's called Genial Universal Flow. I thought this was a tremendously revolutionary type material. It came out about 1.5 years ago, and I've been using it, and I use it a lot, mainly because of these minimal invasive procedures. We're able to then correct that in very simple and very easy clinical time frames. The nice thing about it is that in comparison to conventional flowables, that this material is very highly viscous, so it doesn't slump. There is very little porosity, and there's a tremendous high gloss retention. The flexural strength is very, very good. Wear resistance, I've been mapping out and seeing clinically how my patients are, you know, and I've seen that it really almost self-polishes itself. And I think one of the interesting things about this material is that it's hard surface-like feel to it. It almost feels like, you know, I dare to say, you know, the word ceramic, but it feels very hard, and it's hard to cut and hard to, you know, to trim using even a carbide burr. So I now use a diamond burr to be able to then get it down to and sculpt with. And so that's how hard that surface can be. So this is a smart material and smart technology because they're taking the things that we know and trying to then make our lives easier by putting it into a type of delivery system like a liquid system, and then be able to cure it in a real simple fashion in order to get the results. So I really think this is a nice example of smart technology. Well, in composite resins, you know, smart technology is also something that we would like to first of all ask ourselves, what would we need in order for us to be able to feel like composite resins are much more user-friendly? Well, we certainly want to, so this is my list of things here, and first of all, we wanted to mimic natural coloration. I also would like to have it so that it matches the Vita shade system, a simple nomenclature. Of course, you want it to be easy to handle and easy to sculpt without any sort of stickiness. I wouldn't want it to be slumping, so that I can be sure when I'm sculpting it that it doesn't actually slump or actually fight, you know, my sculpting. We want it to have a beautiful chameleon effect so that it makes having to match it to natural dentition to be very, very simple. And of course, you know, we want it to have very little to no marginal shrinkage. We want it to blend reasonably to tooth so that we're able to chameleon it to tooth, and so you're able to create better invisible margins. And as we can see, 70% are having a hard time. Wouldn't it be nice to have a resin that is a smart resin that helps you instead of fights against you to create that kind of result? And of course, we want this same material to be strong and resistant to fracturing, to have fracture toughness, and most importantly, to be able to be finished and polished to a mirror type shine using a simple technique. These are things that I think are important. And do we have this? Well, let's talk about it. See what we do have. And certainly the composite, we would like to have it so that it's the easiest to use and requires minimal clinical talent. In the past, using composite resin, you basically have to have a skill set for it, because some dentists are very highly skilled at sculpting, and those that are not. And so, to me, a good smart resin would be something that would allow minimal talent. And so if you chose the wrong shade, it would be no problem because it has a chameleon effect. Or for instance, if you had a difficulty to marginate, no problem because the material itself has the ability to have minimal shrinkage. And so these are things to me that we would certainly want to see in a smart resin. Here's a good example of a case where I have these teeth that we're restoring, 6, 7, 8. So these 3 teeth that we'll be restoring. And we have some failing composite resins. So I'm taking out the composite resin, and this is what's left. We want to reinforce the fractures along the surface. We have a class 4 here. And then we're taking out this old facial composite and going to replace it with a new one. And so simply by using one color, you can see on that surface how I'm able to blend to that canine, and then using 2 colors of a body shade of A1 and then a neutral translucency, you can see how I'm able to create a nice result. So this you don't need to have great talent in order for you to be able to create these results. You need to have a material that will be able to help work with you so that you'll be able to get the results you want. And this is where the word innovation comes in, because innovation is a critical thing to me in order for us to be able to change the direction in which composite resin technology has been. Historically, much of the changes that have been done has been in the areas of filler technology. So it has always been changes in the last 30 years in the changes in size of filler, the shape of the filler, or the filler type. And these advances were very important through these times. However, I consider these to be mini steps. And so that has been something that has been really looked at by many different companies. But what's interesting, because innovation means how do we then change what we've done and then to be able to have a much different result, a think outside the box result. And this is where GC came into play, and I really applaud them, because what they did, instead of looking at the filler technology, they went outside the box and collaborated with a very well-known company called DuPont Corporation in order for them and asked them to create a new monomer chain, a new monomer for composite resins. And the whole idea behind this was to be able to see how we can overcome company and having a look at the problems that we have in dentistry and be able to create something like this, to me, is astonishing. So it really goes to the word innovation, and it was an innovative thing for GC Corporation to go outside the box and be able to discover this new monomer. Well, let me tell you about this new monomer. It first of all has this rigid core, a long rigid core, and this long rigid core is a long chain that helps to prevent monomer deformation and reduces shrinkage. So this is important because it directly relates to polymerization shrinkage and shrinkage stress on the composite. Why is that important in dentistry? Well, because number one, polymerization shrinkage will head towards marginal leakage eventually, and that's something we don't want to have, because that increases the chance of failure. Shrinkage stress will create problems because post-op sensitivity can become an issue. And so by having this type of monomer chain along with the flexible, what we call reactive arms, we are able to then correct some of the issues as it relates to shrinkage stress, but also be able to have a material that really is non-sticky, and you're able to then sculpt it and be able to sculpt it in such a way that it's not fighting you. That's the problem that I've always had with composite resins in the past, that it's sticky, and every time you try to pull at it, that it would pull off the tooth, and it would have all kinds of problems. However, now with this new material, we're able to have a beautiful result, be able to sculpt, and be able to have a nice result. And I'll show you how I created this case. Beyond the monomer technology, what GC did was they really worked on the filler technology. It was to do two other things. They have a patented high-density pre-polymerized lanthanoid filler, which is a high-density radiopaque filler. This is a real critical thing because with this filler, if it's filled in a wrong way, then it will decrease the chameleon effect. So they had to be really careful with the filler. They also had a proprietary silane that was created for each of the fillers so they would create better resin binding. So these are true innovations that allow us to be able to have leaps forward into the composite resin technology world. So simply, through GC's polymer technology and DuPont's monomer technology, this is where GC Color was born. And I use this volcano here in the background since I'm in Hawaii, because as volcanoes create new landscapes in the islands, it's certainly GC Color is creating new landscape as it relates to composite resin technology. You can see how these are clinical examples of beautiful results that we can get with the class 4 on the upper case. And as you can see here, how I'm able to literally with just 2 shades be able to create a beautiful finish with this material with simple layering techniques. Now, some other characteristics of this material is really quite nice because it's you can achieve a porcelain-like surface. Take a look at the results below. You can see how it's very, very high. You get this high luster effect. And the ease in polishing is tremendous because of the type of composite it is. This nano hybrid is if you're using any sort of composite, you should be using a nano hybrid, just so you know. So I would definitely not be using the composite resin old technology, and we certainly want to be using new technology for our patients. This plucking phenomena is something that is a problem as it relates to microhybrids, and that's why you're unable to achieve a high gloss. But because of the 3 different technological advancements in this material, you're able to then keep this high gloss, reduce the plucking phenomena, and you're able to have a nice surface luster for long-term success. And of course, the shade matching and chameleon effects are tremendous as it relates to this. The chameleon effect is it's basically using different refractive index fillers and having it combined in such a way that it is reflecting, refracting, and absorbing light at different rates that is similar to teeth. And so when you have it restored in a surrounding tooth structure, it will scatter the light in a very natural way, and thereby creating this, what has been called the chameleon effect. As you can see here in the class 4, I'm able to restore these two with simply 2 colors, an opacious dentin layer and a body shade. That's all. That's all I use for these 2 restorations, an opacious dentin replacement and a body shade. Very simple. As I mentioned, because of the DuPont monomer, you have a very easy ability in controlling the material. It's not sticky. And the shrinkage stress, like I mentioned, is very important, especially in posterior restorations, as you can see in this quadrant of teeth that I had restored, that we're able to then create predictable results and have your patients be very comfortable, especially in trying to extend, when you're trying to extend restorations this close to the cuspal, the cusp, along the functional cusp, excuse me. You know, it can sometimes become an issue with regard to cuspal flexure and then issues of sensitivity. We do not have that problem anymore because of the stability of this material. And these teeth belong to this lovely lady, this lovely young lady. She's Miss Hawaii in 2009, Ariana, and you can see her beautiful smile is made from the color material as well as her posterior teeth. And so you can see how beautiful the results can be. In this same individual, you can see how we have that failing class 2. And what I do is very, very helpful, and I use them every day of my clinical life, and I've reduced the incidence of root canal treatment because of it. You know, you'd be astonished. For those of you who do not use RMGIs, it is amazing. Now, you know, and then from there, you put your bonding adhesive on, and then from there, you're using your nanohybrid, your enamel replacement, what I call a biomemory, polished up very, very nicely. Okay, and so now, a lot of people don't know about this material, and so that's why it's, you know, it comes in different types of kits. It comes in a full line kit or a trial kit. So this is really quite, you know, it's a very versatile type thing. You know, one of the things that I want to ask you, and there's a second poll I'm going to be conducting right now, is what type of composites are you using around the world? And so let's conduct that poll. Okay, here it comes. The question is, are you currently using a nanohybrid composite? If not, what type of composite resin are you using? Let's start the poll. We'll give you about 15 seconds. It's very interesting as I see the poll develop. Okay, it looks like we're just about finished with the poll, so I'm going to go ahead and close the poll. Here we go. All right, so let's show the results of that poll. And here it is. Nearly 50% are using a nanohybrid. That's fantastic. However, I think that 100% of us should be using a nanohybrid at this point. Mainly because, again, you're getting the best worlds of everything. You know, when you're using a microfill, you're going to get good polishability, but you're not going to have the strength. And, you know, with the microfill, you'll be able to have a nice, you know, blending, but you certainly are going to have to use it along with something like a hybrid in order to create a combination of strength and beauty. Microhybrids, you know, as I mentioned before, you know, the plucking phenomena occurs quite frequently in a microhybrid because it's older technology. And so because of that, you probably may not be getting the best shine, surface luster with a microhybrid. And so, you know, regardless of what nanohybrid you choose, I think it's a good one that you go towards a nanohybrid. However, it's nice to see that nearly 50% are using it. So let's look at a case. And here's this case. And it's a case of a gingival recession. along the canine and 2 premolars in a 33-year-old male. And due to the recession, it's affected him aesthetically. Class 5 restorations were recommended and accepted as a MI restorative treatment plan. Minimal invasive treatment plan, excuse me. Prior to actually restoring, this is what I do. I will actually use composite balls in order to determine the correct shade of my that I'm going to be using. And so I recommend that you always do your shade checks prior to starting doing any sort of preparation, because realize that as time goes on during your procedure, you will have the color of the teeth become dehydrated, and therefore the color. Be careful when you do your actual shade check. It should be at the very beginning of treatment, and so that you're able to get the correct coloration that you're going to be using. All right. Now I want to point out that with my cursor, you can see this color right here. I placed this composite here in, and this is a body shade that I placed in here to see if this was going to be enough to mask out the darkness of the root, as you can see on this here. And in evaluating this, I felt that it wasn't going to be wasn't going to have enough of ability of blocking out the color, and so instead I would use this color here, which is an opacious dentin color, which then will block out the color underneath, and then I'll place a body shade on top in order for me to create the best result possible. And so again, shade checking is very, very critical in order for you to be able to have good invisible restorative results. Okay. In comparison to previous generations, Color shows an increase in performance and less shrinkage, better polishability, and the ability to attain a nice surface luster, better wear resistance, and flexural strength. So these are really nice to be able to see that. And so now going to my technique here, one of the things I do, first of all, is I always will do cord isolation, and I use something that's not typical. I don't use an actual cord that cord packing cord that you normally would buy. I use a suture cord. Now the suture cords that I use are ones that are like on a spool that you use for suture material. However, so this is something that you can buy. It's in a spool, and like thread on a spool, and you can actually get it from your dental supply company. It's very thin, and so when I pack this, I'm not going to be breaking any blood vessels. This is very important, because once you start breaking capillary blood vessels, you're going to start to have bleeding and contamination, and it's certainly going to become a problem as you are trying to restore it. So I always try to be very light-handed in placing these cords, and you'd be surprised how very, very minimal invasive that you can be in actually restoring these teeth. So the first thing is I place my cord, and then I'm going to do a selective etch, and using the etching on the enamel only, so along the enamel surface, I'm going to etch the enamel surface, and then from there I'm going to go ahead and use a 7th generation adhesive, and in this case G-Bond that I use, and I'm going to place this along the surface here. And then what I'm going to do, which is a very important thing, I'm going to wait about 5 to 10 seconds, and then I'm going to blast it with my air water syringe to blast any sort of water residue that's that is on there. When you're using a 7th generation adhesive, be very careful, because the 7th generation adhesive has a side effect of having water molecules develop. And so if you do not remove the water molecules, then when you cure the actual adhesive resin and place your composite on, you may actually run into a delamination of the restorative material because of that side effect that occurs. And so be sure you hit it with air for at least 10 seconds, then go ahead and cure your adhesive, and then you can go ahead and start restoring. And then, as I mentioned, I use an opacious AO2 to block out the dark coloration of the root. And then I'm going to use a universal A1 shade, which is a body shade along the surface. And you can start to see how I'm blending it to the actual tooth structure correctly. Now, would you use a translucency along the gingival third? Well, not really, because think about it, that along the gingival third, you really don't have a lot of blending effect as it relates to class 5s. And then from that point, you're able to simply finish and polish. You can see how with the 2 premolars, I created more of a textured effect, and so it looked natural. And for those, and I created a much more highly polished effect for the canine. And so you can see the 2 different types of finishes you can create, and it's very versatile, in using composites and nanohybrids now. It has a full spectrum of colors with this material. As I mentioned, this is a full aesthetic line. I love this. These opacious shades. I love these here. I primarily use the A02, and sometimes for brighter shades, I'll use the OBW, which is an opacious bleach white. The universal shades you can see is nice. I think one of the nice things, especially for a lot older patients, are these cervical shades here. And then finally, the translucent shades, the white translucent is for younger patients. Dark translucent is for older patients, and neutral translucent is probably the most popular thing I use, as I'm restoring. So that's a really beautiful color. And so now let's look to see how we're able to then restore a class 4 very predictably. Okay. So let's take a look at the class 4. We want to be able to create this result. And this is a before and after. I showed you this earlier, the after, and this actually is 2 years later that I took this photo. And so it's still very nice, and even after 2 years. This is a person who is a 46-year-old female who presents with a failing composite resin, as you can see on the right central incisor, and along the other central incisor, it is what we call lingual angled or lingual verted. And so what she wants to do is to replace this composite here and to have the 2 teeth become more in line with each other. And so that's the objective. So as I mentioned before, prior to doing anything else, I wanted to go ahead and create my menu or my list of layering as to which color am I going to use first and second. And so you can see the various shades. As I mentioned, this A02 is very nice, especially when you want to go ahead and cover this type of show through here. And then the A1, you can see I'm using GT, and I think this is a little too strong for this case. I think the neutral translucency is much better to blending to the actual tooth structure. And the A2 I would use more towards the gingival area. And so, in natural teeth, this is a really common type of layering to use, like an A02 for class 4, an A1, A2, and a neutral translucency. I find that combination all the time to work very well, in typical types of situations. And then from there, I'm using minimal invasive tooth prep. You can see how it's been a very minimal invasive. I virtually just take out the restoration, and then I just refresh the enamel tags, enamel surface, so that I'm able to then bond to it much better. Then from there, one of the things that I do is I place a clear strip interproximally, so that I can be sure that I don't have any sort of etchant in between here or adhesive in between here, because I do what's called a freehand sculpt or freehand build technique. I do not like using interproximal matrices when I'm using composites, because I feel as if I cannot create the best anatomical shape. I want to create a nice convex surface, so in order for me to do that, I feel doing a freehand sculpting technique allows me to be able to control that much better. So that's what I'm going to be showing you today. And so I did my etching, I placed my adhesive, and then you can start to see how that A02 really helps to decrease the shine through. And it really blocks out that area interproximally, doesn't it? And you see how it already starts to blend to the tooth structure. So think of A02 as a dentin replacement, and you're able to then the other shades as the body shades being more enamel replacement, and then the translucency shades being incisal edge replacement. And then I'm going to place my body shade, and you can start to see that chameleon effect coming through already, how we're able to then blend to the tooth structure. So we're not finished quite yet. Here's Genio Bond. I use this also. You know, G-Bond and Genio Bond, they're all very nice products. And once again, with these all-in-one 7th generation, be sure you blast that air before you do your final cure. Then I'm going to do some internal striations to create better natural reflection, refraction, and absorption of light. And then after I do that with the body shade, then I'm going to layer this neutral translucency along the surface, and so I'm able to create a good depth of shade. And then I'm going to use, which I don't show here, but I'm going to use a flat artist brush to be able to create the best smoothness possible and create good anatomy as well as good surface texture prior to curing, so it'll help to eliminate the amount of time that's needed for finishing and polishing. And you can see here with the anatomic burrs, as well as the secondary anatomy developing with the 3M discs. This is 3M's Softflex disc. I'm able to create a nice synergistic type of surface where I can then polish and finish using aluminum oxide points. And you can see the results that we get with this. You can see how the blockout is really quite nice in approximately. It's very natural in the blockout. I hope you'll agree with me on that. And this is 2 years post-op. You can see the surface luster, that plucking effect that occurs, and so you're able to create that surface luster in a very good way. And then most importantly, be able to have a nice functional restoration and aesthetically sound restoration. It'll pick up stain. Any composite will pick up stain, but the nice thing is you can polish it off very simply. You know, aesthetics is evolving. And technology allows for minimal invasive procedures to emerge. And it's not just in conservative minimal invasive dentistry, but also in other areas of dentistry, such as lasers and CAD/CAM and digital radiography. And so look into technology in order so we can help our patients in the best possible way. Minimal invasive dentistry has been on the rise since 2008. However, I've been writing articles since 2004, you know, on minimal invasive dentistry, and one of my mentors is Professor Hien No out of Australia, and I had read a series of these articles back in the year 2000, which really changed the course of how I do dentistry now. And so if you're interested in it, it's a Quintessence International 2000 publication, and here's the literature review on that. Minimal invasive dentistry is also about prep design and making sure that we have good preparation burrs and methods of being able to reduce and be able to hold on to as much tooth structure as possible. I love these burrs here. This is from the Comet USA line, and so you can see here how I'm able to do a minimal invasive type of preparation and then use a Fuji liner to be able to do a pulp capping to be able to help that nerve along, and then I'm simply using the one color of just the body shade alone, and you can see that I believe I used just an A2, a universal A2, and look to see how it chameleons to the tooth and after final finishing and polishing. It's beautiful. Just one color alone. And this is what it looks like radiographically. The radiopacity is really critical because, as I mentioned before, that if you have too harsh of a radiopaque marker in the composite, it starts to lose that chameleon effect, and so we need to be very careful about that. And so this is quite a nice balance, I find, with this material. And so let's go over this step by step on the class 4. And first of all, one of the things that I'm going to do is I'm going to create a putty matrix before I prep my tooth. And it looks just like that. Okay, you can use any putty you want. I'm using Excellence putty in this case, but you want to have that anatomy of the lingual and the interproximal area defined right along here, just so that you can create that anatomy as you are building that lingual shell, as we're going to talk about soon. And then from there, the different preparations that we're going to do, I'll show you very specifically how that's important. I'm showing here a dovetail. You don't have to do dovetail anymore, but you can see how you can use the micro prep burrs or minimal preparation burrs for that. And then this is one of the most important things is the preparation design. I do what's called a double bevel technique. And as you can see here from the actual restoration, I will go ahead and do my first bevel and then my second bevel. And I like to keep my bevel near the line angle or the center of the tooth, or if need be to the other line angle. Just because those heights of contour, you're able to then blend into the tooth structure and it looks more natural. The other thing that I do is I scallop my margin so that my margin is irregular. That irregularness doesn't allow for light to break in a very linear or straight way, which then creates, again, a natural effect. You can see that some people describe this as a sunburst type of irregularness. I call it just a scalloped irregular type of line you can see right here. Okay, and so very important, the double bevel technique as well as scalloping on the second bevel line. Then, as I mentioned, I place this clear matrix here to protect the surface so I don't get any sort of etching or any sort of adhesive on that surface. And then I'm going to place my selective etch technique. I'm going to etch the enamel. Then I'll place my adhesive on, and I'll light cure. And now, because I protected that surface, I can now go ahead and do a freehand build without feeling that as if I'm going to splint my composite to the adjacent tooth. All right? And now I'm going to build this lingual shelf here, and I'm going to sculpt it into the tooth structure so that we're able to then, and I'm using an A1 color in order for me to create this type of effect. And take a look at this here. Looks just like that. One of the questions I have here is that how do I make the interproximal clean without a clear matrix? Well, certainly, it's using, one of the things that I use is I use an interproximal carver, an IPC, or as you will see, I use a gold handle spatula to be able to sculpt in the proximal area. And then after that, after I cure that, I'll pop that contact with an Explorer. And then what I'll do is I'll use Epitech strips to be able to nicely clean up that area. Why don't I etch the dentin? You can etch the dentin. Certainly you can etch the dentin if you want to. I just use it's just that with the all-in type, all-in-one types of bonding, you don't need to, it's a self-etching type of adhesive, so you don't need to over-etch the dentin. So certainly, but if you feel much more comfortable etching dentin, feel free to do so. Okay? And now, after I create that lingual shell, as you can see here, you can see how I'm able to use my A02 and simply sculpt to do a dentin replacement right in this area here. Okay? And as I place that in, that's going to be blocking out the shine through. And then I'm going to sculpt my body shade. This is the A1 shade that I'm going to sculpt on the surface. And you can start to see how I blocked out that color, but also I'm starting to develop color. Using the freehand technique, what I'm doing is I'm shaping right along in here a little well, so I'm going to place some color. Maybe it could be some gray, it could be some violet color, but I want it to mimic the coloration of what I see along the natural tooth itself. And you can see here, this is the color that I'm using. And there's another question regarding genial bond. Yes, you need to go ahead and do the same thing with the air dry for 10 seconds. And you really got to blast it. Get that air water tip really close so you can blast it so that you're able to then get that water molecule out of there. So that all-in-one type of technology of adhesives for all of them, you got to do that, or else you will run into a problem with the water tree effect. I'm trying to answer questions along the way, so I apologize for some of you who are thinking, well, didn't he just talk about that? or is he jumping back? No, actually, I'm just trying to answer some questions to clarify things along the way, okay? And then from there, after I've placed my color in here, I'm going to place my neutral translucency, and using these types of sculpting instruments, including this nice gold handle. This is at IPC, the question about the clean interproximal surface. I make sure I get it right in between here so I can create a nice convex surface. You can see how I'm starting to create a nice clean surface right there. All right. Now, a critical thing is don't overbulk. Remember, you just want to build to what you want, to the contour that is there. You don't want to overbuild the contour because then it's just going to take more time during the finishing and polishing phase. So take the time to just use enough to do what you need to do, and then from there, I'll tell you, you're going to make your clinical life so much easier. Here's another critical step. Another critical step is using this brush. I would urge you all to get an artist brush because this will save you 20 minutes of clinical time in shaping your final external contour before you do the final curing of the surface. Okay, very, very important in order for you to be able to shape this using an artist brush. I put a little bit of filled resin in it. You can use, or unfilled resin. You could use any sort of unfilled resin, or you can use, Visco has something called a sculpting resin. So it's a filled resin, so you dip it in there and it wets the brush so you're able to sculpt. But this thing about Colora is that you really don't even need a wetting agent for you to be able to sculpt with. So that's something you don't have to even worry about. Okay, so because again it doesn't even stick. But you see how I created that surface. I created the line angles here. You can see where the light is breaking. This is prior to curing. And this is with the flat horsehair brush. If you go to an artist store, it's a number 4 flat horsehair brush. One question about sterilizing brushes is that these are disposable, and so you can dispose of them. One of the things I wouldn't put into an autoclave. You could use an alcohol wipes if you want to do that, but there are disposable tips if you're interested in it as well. You can see here if the line angle is too far out, this is a common problem we have with central incisors. Doesn't this central incisor look wider than this central incisor? It does, right? And one of the reasons is because the primary line angle is too far out. So I need to move that primary line angle a little further in so that it doesn't look visually too wide. One of the things that patients can pick up on is if the tooth is too gray or too bright, or if the tooth is too wide when we're dealing with central incisors. Okay, so they can definitely tell that when you're dealing with the central incisor. So now with my 3M discs, I'm going to create and take away this excess right here and create a nice incisal halo. And using the 3M disc, this is a coarse. You want to be very careful so that you're not over trimming, okay? Because remember, if you take the time to go ahead and finish it down with your horsehair brush, then you don't want to over trim it. You want to do some very simple types of finishing, okay? And then from there, you can create texture. And how I create texture, see, this tooth doesn't need much texture, but the other tooth that I showed earlier did need texture, so I use simply at this stage I will use a medium diamond chamfer burr, and I'll create texture here. I'll create stippling, and then from there go back to your 3M soft lift sticks, and you'll be able to polish this up. Okay. So here, because remember, as with this material, it's very little marginal shrinkage, so you don't have to do a whole lot right here, but these anatomic burrs do a real nice job in getting around them without ditching. And this is a kit that I developed with Comet. Again, I don't get paid for these kits. I just want to develop it just to help you out, to be able to be sure that you have at least an armamentarium things to be able to work with. And one of them is this egg type of burr. And you can see how we create a beautiful restoration. One of the things I would like to, that I always use is a micro diamond polishing paste, so that you're able to bring out that surface luster so it looks just like that. One of the things I just simply, as a troubleshooting thing, this is one of the things that I've come to find that is a problem, is when you are dealing with little voids. How many of you have this problem? Yeah, we all have this problem, right? You have a little void that, and it usually happens when you put your last layer on and you cure it, and as you're curing it, you can see a bubble in there. And you're thinking, oh, what am I going to do? Do I have to take this whole thing off? Whatnot? And, one of the things I do is using technology. Use smart technology now to be able to help you decrease your stress to repair or filling in the voids. Okay, so if I have a void here, a bubble right there, one of the things that I'm going to do is I'm going to take out the bubble with a mini prep burr. And so basically what I'm doing is I'm taking it out. It looks like this. So it's a divot that I'm putting into the composite. Okay. Then what I'm doing is I'm taking a larger round burr, and so instead of it having to be like a cup shape, now I'm created more like a saucer shape, so that the line. So it's basically I'm creating bevels along the sides of it, real simply. And then now I'm going to use my smart resin technology. Here comes the Genio Universal Flow. Remember, it's a filled resin. It's a restorative resin. Do not use a conventional flowable, because your patient will brush that away, with their toothbrush over time. But if you use this filled a liquid composite called Genio Universal Flow, you'll be able to then simply sculpt this and be able to fill that in, no problem. The nice thing is that it's in a family of product lines that comes from GC. So, if you're using Color and you have the Genio Universal Flow, it's going to blend together. Okay. And this is that product. Here's that texture. You can see. You can look at the texture that I created here. This is using a medium chamfered diamond, and then after I create the texture, then I go back with my soft flex, and then I go back to my polishing. Okay. One of the questions that someone had is, do I recommend a coating agent? A coating agent, I'm not sure if you're referring to a glaze. I don't recommend glazes for final finishes. I do recommend it if you're running out of time, and you can use like a nano coat. Or if you heard of the G-Coat Plus by GC, or Biz Cover by Bisco, those are nice glazes that are out there, but I don't recommend it for a final type finish, because you're not going to be able to have a long-term type of finish polish. You are definitely going to run, so I would definitely want you to go through the whole protocol of finishing using the Softflex discs, and then going ahead with the composite finishing burrs, and then from there using the finishing technique of having to use micro diamond polishing paste, and you're going to have a beautiful restoration that's going to last you a long time. You can see here how I built this, and one of the things to always remember is looking at it from the incisal perspective, because you can see here how I recreated this contour to match this contour. You see that? And so that's very important when you're dealing with central incisors, is to always don't forget to look from the incisal or occlusal perspective, so that you're able to know that you're not overbulked or underbulked. Some of the keys to success with composites is you want to have good shade selection. You want to have a base shade, variations to this shade. You want to be able to see characterizations as well as translucency, so you're able to create a nice selection of color. And remember, select your shade before you actually start working. Then the next milestone here of a success is using preparation design. I do that double bevel technique with the scalloping of the second bevel. Very important in order for you to create an invisible margin. Then you want to have a proper layering. Proper layering, as we mentioned before, sometimes you can do it in a very simple layering because of the nice blending effects of the materials that you have. But if you have materials that are nanohybrid, that have good blending effects or good comedian effects, I'll tell you, a lot of times I'm just using one color along a class 5 lesion. When I have to go and do a dark root, then I'm going to put an opacious dent in there, and then I'm going to cover it with a body shade. Or but most all the times I'm using one shade on posterior teeth. I'm using just one shade, and that's the beauty behind smart resin technology. Surface texture, as we mentioned. be mindful of the adjacent teeth. And when you're dealing with central incisors, look at the topography, the surface texture, and mimic that here. Okay? And that's what you're going to be successful. So it's not just about shade selection and design, but it's also about surface texturing. And finally, as I mentioned, the finishing and polishing. Very important. Okay? And once you get to that point where you're able to feel very comfortable with composite resins, you're able to get to a point where you're able to now build composite resin veneers. Now this is a before, this is old direct composite resin veneers, and then from there you're able to create beautiful restorations like this with your own hands. This is with a combination technique that I use with laser gingival sculpting. As you can see here how I lengthened these teeth here, because these underneath the composites were all a lot of diastemas and a lot of small narrow teeth, so very large spaces interproximally that were closed up. But you can see here, using the opacious dentin and the technological advancements in composites, I'm able to close the spaces up and not have it look like there were spaces to begin with. You can see that. And this case was done at the American Dental Association meeting, what we call Education in the Round. This Education in the Round is a live patient program, so I created this in live time. I did these 4 composite veneers in live time in 2.5 hours. So, if I can do this in 2.5 hours, you can do it in 2.5 hours. It's just going to need a lot of time in filming, okay, in developing your skill. But just know that to get good materials and get good techniques in order for you to be able to get the best results.